The new Omicron variant has now been detected in more than 60 countries around the world. We expect it to continue to spread to many other countries over time, and we will continue to monitor the global situation closely. Locally, we have also detected 16 Omicron cases to date. 14 are imported cases, while 2 are local cases. All the local cases were working at the airport. While we have not detected any transmission within the community yet, it is only a matter of time before this happens, given the experience of other countries. This may then lead to another surge in cases because of the highly infectious nature of the Omicron variant. We must therefore prepare ourselves for such a scenario. Vaccination remains our main defense against COVID-19, including the Omicron variant. We are stepping up our booster program to ensure that our population continues to be protected against severe outcomes. I would like to encourage those who are eligible to get your booster shot as soon as possible. We are also rolling out the vaccination program to younger children aged 5 to 11 years. I urge those who are still not vaccinated yet, especially our seniors, not to wait any longer. Vaccination-differentiated SMMs, or what we call VDS, plays an important part in protecting those who are yet unvaccinated, protect them from severe illnesses. We have expanded the VDS to more settings and activities from 1st December, including all libraries under the National Library Board and selected activities in the community clubs. From 1st February, we will further expand VDS to other settings and activities. Individuals who are medically ineligible for vaccination will continue to be exempted from VDS. We had earlier rolled out the VDS plus test pilots in sports settings, selected mass sporting events, as well as selected MICE events. These pilots have been successful, and we will continue to expand them where feasible. To date, work from home has been the default arrangement. We recognize that this arrangement is not ideal and not sustainable in the long run, as face-to-face interaction is important for team dynamics as well as other operational considerations. With the implementation of workplace vaccination measures, we are in a better position to ease up on the work-from-home arrangement. Therefore, from 1st January next year, we will allow up to 50% of those who can work from home to return to their workplace. We will also raise the cap on participants in work-related events, so long as all of them remain masked, are seated at a safe distance from one another, and meet the VDS requirements. However, social gatherings at the workplace will continue to be disallowed to minimize mingling and reduce infection risks. 2 weeks ago, Singapore and Malaysia launched the VTL LAN. This allows us to restore connectivity across our countries so that Singaporeans and Malaysians on both sides of the border could reunite with their families. To allow more people the opportunity to reunite with their families and see their loved ones, from 20th December, Singapore citizens will be able to enter Malaysia, and Malaysian citizens can enter Singapore on the VTL LAN arrangement, even if they are not PRs or long-term pass holders of the destination country. All travelers entering Singapore will have to abide by the prevailing test protocols and the safe management measures, which include the post-arrival 7-day COVID-19 ART regime. We will continue to monitor the demand for the VTL LAN and adjust and review the capacity accordingly, taking into account public health situations in both countries. I want to thank everyone for your support and cooperation. We will continue to keep a close watch on the situation to prepare ourselves for a potential increase in Omicron cases within the community. As we approach the holiday season, I would like to remind everyone to remain vigilant continue to exercise social responsibility, obey the SMM rules, and test yourself whenever necessary. Let us continue to work together towards COVID resilience Singapore. Thank you very much.
Thank you, Kim-yong. We are in a good position now. Together we have rode through a significant Delta transmission wave, which peaked at over 3,000 cases a day. But if you look at the situation we are now today, daily cases are 3-digit and often below 500. Total number of COVID-19 patients in our system is now under 4,000. At its peak is over 26,000. That was in end October. ICU beds at its peak, 160 or more, now is about 30, just slightly above 30. And hospital beds, CTF beds, means COVID treatment facilities beds, all occupancies are at a healthy level. In other words, the bicycle we are riding are now on a gentle slope, the brakes lightly applied, and our ride is comfortable. So our healthcare workers are also getting a respite because of this. They are able to take turns to go on leave. The foreign healthcare workers are able to use VTLs to reunite with their families. And that's all very important. But this peaceful state may not last long, for there is a potentially big Omicron wave coming our way, and we need to get prepared. The question is, what kind of transmission wave is Omicron? Data from overseas suggests that it will be more transmissible than Delta, so we may be looking at a large wave. But there are also indications that Omicron infections may be milder. So some will ask, why not just shut our borders and prevent Omicron from coming? There are two important considerations, having accumulated experience over almost 2 years. First, we have to ask, do we still believe in living with COVID? We can't say, for Delta variant, let's live with COVID. For Omicron variant, let's have zero COVID policy. It's not coherent. It doesn't work that way. Especially given that we have come this far, we have ridden through a big Delta wave together, we have built up our defenses, and we have gotten life somewhat back to normal. So I don't think we would want to give all that up and go back to where we were last year, before Omicron. Second consideration is that it is actually not realistic to stop Omicron from coming into our small city-state. We can, and we have, temporarily suspend short-term travel to affected countries in Africa. And this is to buy us time so that we can understand the variant better. But Omicron, as of now, has spread to more than 60 countries, including those in Europe, the US, and some of our regional neighbors. So soon it will be in great abundance all around us. And like Delta, it is not possible to keep Omicron out, even if we shut all our borders. So we have to learn to live with Omicron as we have with Delta. And to do so, we will need to understand the virus, understand the variant, adjust our policies, because this variant will be different, with slightly different characteristics. There is a chance that it causes milder infections. South Africa and European countries are reporting fewer incidences of hospitalization, and those hospitalized tend not to require oxygen supplementation, and they stay shorter durations, typically 1 to 3 days. But I must caveat that it is early days, and so far, Omicron infections tend to be amongst younger patients. And we need at least a couple more weeks for the transmission to play out and for us to better understand the severity of the variant. With each week, the picture becomes clearer. However, even if Omicron infections are indeed milder, it can still cause us big problems. For example, if the risk of hospitalization requiring oxygen supplementation or ICU is, let's say half that of Delta, but the Omicron variant, let's say, can spread to twice as many people, the two factors cancel out, which means our healthcare system will face the same pressure as when we had the Delta wave. And if Omicron spread faster to unvaccinated seniors, the problem is actually bigger. So to reduce the number of people who fall very sick, we still need to fall back on vaccinations and boosters. That remains our primary response to deal with Omicron variant. So today, we will present the following thrusts of this whole action plan. First, of course, step up vaccination and boosting. Second, adjust our healthcare protocols. Third, further strengthen healthcare capacity. Four, prepare therapeutics to treat potentially severe cases. And finally, adjust our safe management measures. The key changes, Min Gan has already mentioned, but I will elaborate on the first two. DMS and SMS Janil will talk about the next two and also share further information on vaccination on children. And then Minister Lawrence Wong will talk about safe management measures. So first, vaccinations and boosters. A recent study in the UK revealed some important insights. For 2 doses of Pfizer-BioNTech, vaccine effectiveness against Omicron infection dropped from about 90% 1 month after the second dose to about 50% after 3 months, and then 35% 4 months and beyond. So this erosion of protection is quite fast. But then, 2 weeks after a booster, vaccine effectiveness against Omicron infection shot back up to 75%, which is encouraging. It means boosters work. And this is protection against symptomatic infection. If we look at protection against severe illnesses, the protection level is likely to be much higher. Also encouraging. That is why vaccination will continue to be central to our response. We must continue to get the unvaccinated vaccinated. There are about 160,000 of them in Singapore today, with 40,000 who are seniors aged 60 and above. And they are all at very high risk of falling very sick, needing ICU care or die if they are infected with COVID-19. We will also need to administer as many boosters as possible to those who are due to take them and to get them well protected against Omicron early. As I mentioned at an earlier media conference, due to the emergence of COVID-19 variants, we need to treat COVID-19 primary vaccination as a 3-dose regime. And our policies need to be geared towards that. We will therefore have to set a validity period for full vaccination status. This means that after 2 doses of mRNA vaccines and 3 doses of Sinopharm vaccines, our full vaccination status will last a limited period. MOH is consulting the EC19V to determine what this duration should be. And this is a clear signal that we all need to take our boosters. Because with waning protection, full vaccination status cannot last perpetually. So take our boosters and our full vaccination status. Let me repeat that. So take our boosters and our full vaccination status will be extended, and we will be able to access various amenities under our VDS framework. We expect to announce the new policy at the end of this year or early next year. But please be assured, we will design the policy such that If you have not been given a chance to get your booster, your full vaccination status will not lapse. Similarly, if you belong to not eligible for boosters, such as those aged 18 and below, your full vaccination status will also not lapse. Encouraging vaccination and boosters is also the context within which we announced two recent moves: vaccinating children aged 5 to 11 years old and extending boosters to young people aged 18 to 29. And these are significant moves. It means in December 2021 and January 2022, we will administer about 2.1 million doses of vaccines to individuals. About 700,000 more if we had not expanded the program. So if we follow through, at the end of January 2022, about 54% of our total population will be covered by boosters. The two mRNA vaccines can be used interchangeably as boosters. For the month of December, we have more Moderna supplies. So if you are eligible to receive your booster shots, and if you choose to take a Moderna booster, you can just walk into a Moderna vaccination center for your jab. There's no need to pre-book a slot. We are also making a few operational adjustments. For example, the exemption for BDS for a recovered patient will be adjusted downwards from 270 days to 180 days. And this is to take into account the faster waning immunity due to the Omicron variant. We are also reducing the monitoring time after receiving boosters from 30 minutes to 15 minutes. Because our data shows very low incidence rate of significant acute adverse reactions after taking boosters. And so this will expand our booster delivering capacity. We are also planning to set up more vaccination centers to support children vaccination and also boostering during this period. Next, let me talk about health protocols. We have made significant changes to our health protocols as we rode through the Delta transmission wave. And the primary consideration is this: because with the great majority of us fully vaccinated, most infected individuals experience mild symptoms or no symptoms. Hence, it is no longer necessary or practical to put everyone in hospitals. So right-siting COVID-19 patients is important so that acute healthcare resources are available to those who truly need them. And that is why we implemented the HRP, Home Recovery Program. We want to thank everyone for your patience and understanding as we set up the program and for making the HRP a success. I want to especially thank our GPs for playing a very big and vital role in this regard. They administer PCR tests for their patients, and they are also the one who trigger the onboarding process for a patient to be part of HRP. And many GPs have been family physicians for their patients for many years. Hence, they have expressed a strong interest to continue to care for their COVID-19 patients, instead of having them onboarded into a national HRP. MOH supports this because maintaining that long-term doctor-patient relationship is actually the essence of primary care. We are therefore thinking through how to have our GPs play an even bigger role, especially if we ever have a big Omicron wave. And one key idea that we are working on is this. In our simplified healthcare protocol 123, most of you should be familiar, we provided the option under protocol 2 for those who feel they are well, yet tested positive with an ART kit, to just rest at home and then come out when they are tested ART negative. If Omicron is indeed milder but transmits faster, then we need to push the idea of right sighting even further. Today, GPs only prescribe a PCR test to someone who feels unwell. If tested positive, the patient will most likely be put under HRP for 10 days. We can further empower our GPs so that they can judge the disposition and the risk profile of the patient and order either a PCR or an ART test. So for very mild or asymptomatic cases, the GP may want to just order an ART test. And if positive, the patient may be asked to go on a few days of MC, rest at home, and come out when tested ART negative. In other words, Protocol 123 will remain, but the GP can now trigger not just Protocol 1, but also Protocol 2 with an MC. And GPs can even follow up to care for their patients. So even within the more formal HRP system, there is scope for the GPs to be providing follow-up care instead of centralized, coordinated care administered by MOH. So this is an idea and a proposal that we'll be engaging the GPs on in the coming days. I will now pass the floor to Dr. Janil to further explain children vaccination. Thank you.
Good afternoon, everybody. The National Vaccination Program has shown encouraging results. As of the 11th of December 2021, 87% of our total population are fully vaccinated, and vaccination coverage ranges from 91% to 97% for eligible age groups. Over the weekend, the Health Sciences Authority, HSA, approved the use of the pediatric doses of the Pfizer-BioNTech Comirnaty COVID-19 vaccine for children aged 5 to 11 years. The Expert Committee on COVID-19 Vaccination, EC19V, has also recommended its use for this age group. The process of deriving those recommendations included consultations and engagements with healthcare workers and clinical care providers looking after children. For example, the College of Pediatrics under the Academy of Medicine, GPs, community pediatricians, the teams at NUH and KK Hospital looking after tertiary pediatric issues. And they support this move. The main reason why they are supportive of this assessment, why they agree with the assessment of the EC19V and HSA, is the analysis that the benefits of vaccination far outweigh the risks of getting COVID-19. There's a very small risk of a serious event happening with a vaccination. It's something like 1 in a million. But a serious event associated with COVID-19 vaccination is about 2 orders of magnitude more likely, about 100 times more likely. It's closer to about 1 in 10,000. And we have seen this happening even here in Singapore, and certainly from the data that we have been studying around the world. Vaccination is safer than getting a COVID-19 infection. COVID-19 does tend to be milder in children compared with adults, and severe disease is uncommon. But there is still a risk of children developing severe disease, with some cases requiring hospitalization, oxygen supplementation, and ICU admission. We're seeing about 1 or 2 cases of multi-system inflammatory syndrome in children, MISC, about 1 to 2 cases every week since mid-October 2021, and some of these children have required ICU care. Getting our children aged 5 years and older to receive the COVID-19 vaccination will help protect our children from getting the COVID-19 infection and keep them from getting seriously sick even if they do get COVID-19. So, reducing the risk of severe complications such as MISC. The study in the US of the Pfizer-BioNTech vaccine was in children between the ages of 5 and 11 years old. And this study demonstrated a vaccine efficacy against symptomatic infection of about 90.7%. Our children, as you know, will spend a lot of their time in places like schools and preschools. And here, transmission can spread quickly, not just of COVID-19, of any disease, as the children interact. And this then puts at risk the family members of such children, whether they are siblings who are younger and so not yet eligible for vaccination, or those who are older, such as the grandparents, who even if they are vaccinated, the risks are higher. And so by reducing the transmission in this age group, 5 to 11, we protect them from the risks of severe complications of COVID-19, but we also protect the rest of their family. Putting all this in place through vaccinations for this age group will reduce the risk of transmission in children of school-going age, and it means that there's less likely to be a disruption to their education and their opportunity and ability to carry out co-curricular activities, which is what we want for them. The dose of the Pfizer-BioNTech Comirnaty vaccine for children aged 5 to 11 is 10 micrograms. It's 1/3 the dose for individuals that are older. And for COVID-19 vaccination, children may also experience some side effects: muscle pain, redness, swelling, tiredness, headache, fever, chills. These are all signs that the body is reacting to the vaccine and, as a result, building up protection and immunity. And these side effects will go away in a few days. And many people, there's no side effects, and severe reactions such as allergies are quite rare. The trials of the vaccine in the US compared the side effects of children aged 5 to 11 with side effects for young persons aged 16 to 25. And they found that the younger children, 5 to 11, had fewer systemic side effects. We have been giving vaccines locally here across our population, a large number, as I explained at the beginning. And in our population, the older population, we also continue to observe that the risk of side effects like anaphylaxis is low, and it's comparable to many other medications and vaccines. There were no cases of anaphylaxis seen in the US vaccine trial. There were also no cases of myocarditis and pericarditis. Excuse me. There were also no cases of myocarditis and pericarditis in the trial aged 5 to 11 in the Pfizer vaccine in the US. By now, millions of children around the world have been vaccinated using this Pfizer-BioNTech Comirnaty vaccine. Up to 5.5 million children in the US in this age group have received the first dose, and 2.6 million have completed 2 doses as of the 12th of December, with no safety concerns. So it's important that we offer protection to our school children before school activities resume full swing. Vaccination for this group will commence before the end of this year and once we receive deliveries of the vaccine doses. To help us strengthen COVID-19 resilience for Singapore, we need to have our children between the ages of 5 to 11 years old get their vaccination as soon as it's rolled out. We know that parents are concerned. They want the best thing for their children. They want to be able to protect their children and create opportunities for their children. This is what we want as well. And our assessment is the best way to do that is to vaccinate our children against COVID-19. Thank you.
Thank you, SMS. Our focus on the COVID-19 situation in our healthcare facilities, based on the data we had as of yesterday, the 13th of December, and our strategies to prepare for a potential surge of Omicron variant COVID-19 infections in the community. But I'll start off by sharing some information concerning the Omicron cases we've seen in Singapore. And as Minister Gan has shared, we now have a total of 16 cases of Omicron variant COVID-19 infection confirmed by genomic sequencing. 14 were imported cases arising in travelers who entered Singapore after traveling to countries as diverse as the US, UK, France, Germany, Finland, India, Dubai and the UAE, Qatar, Nigeria, Mozambique, and South Africa. Most were detected when they had positive COVID-19 tests on arrival. One traveler was diagnosed while under quarantine after arriving in Singapore and had no contact in the community. The remaining traveler was detected while self-isolating after entering Singapore on a VTL. His household members are all well, and they have so far tested negative. All these imported cases were either asymptomatic or mildly symptomatic. In fact, 2 of the imported cases have since been discharged, and the rest are recovering uneventfully. 2 Omicron infections arose in staff working at Changi Airport, and both were detected through work-required routine regular testing. They were both asymptomatic. They were also fully vaccinated. Our epidemiological investigations have not shown any evidence of the infections being from cases in the community. Their exposure to Omicron is likely to have been from workplace exposure to infected travelers in the transit areas. Their close contacts have been placed on quarantine and remain well, and their COVID-19 tests have been negative to date. We do not have any evidence so far to suggest that Omicron variant is spreading in the community, but we must be prepared for the possibility of more local Omicron cases and clusters arising in future. In the last week, we have seen a steady decrease in the overall number of COVID-19 infections detected and reported daily. Yesterday, we reported 339 cases with 318 local community cases. And the week-on-week infection ratio of community cases was 0.6. Our own estimate of our statistic was about 0.7. The number of active cases in the ICUs of our hospitals and those who need oxygen supplementation has also declined in the past week. The proportion of those infected with COVID-19 who are not fully vaccinated and who had been critically ill at some point in their illness requiring ICU care or had died was 2%, while the proportion among COVID-19 cases who were fully vaccinated was 0.2%. The unvaccinated still pose the highest risk of getting severely infected or dying. They continue to contribute the most to the utilization of healthcare resources in our public hospitals. In the last 2 weeks, 4.1% of those who were not fully vaccinated had severe infection, and this compares to 0.8% amongst fully vaccinated local cases. These unvaccinated infected cases accounted for 53% of all active cases in the ICU or who needed oxygen supplementation. We started our local cases from the 14th of September when we first started booster vaccinations for our population until the 11th of December, which was the end of last week. And among seniors above the age of 60 years, the risk of getting severe infection was 31% among those who were not fully vaccinated. This dropped to 4.4% among those who had been fully vaccinated but had not undergone booster vaccinations. And for those who had received their booster shots, that proportion dropped even further to 0.89%. The booster vaccinations do help protect you further from severe infections. And with our extension of the booster vaccination campaign to include all who are above 18 years of age, more people can derive better protection against the Delta variant, against overall infection, severe infection, and death. The early data suggests that even though vaccine effectiveness decreases with the Omicron variant, the vaccines still provide protection which is beneficial, particularly for those with high risk factors for poor outcome. I shared at previous MTF press conferences about our draw plans to activate beds in reserve to increase our ICU bed capacity to handle the increase in severely ill COVID-19 cases if we see another wave. These drawer plans would have provided an increase from an initial 180 bed capacity to up to 500 beds. At the peak of our Delta wave in the late October or November of 2021, we surged our ICU bed capacity to about 280 beds, with hospitals on standby to increase that capacity to 350 beds at very short notice. Now, for the Omicron variant with its increased transmissibility, we are preparing for the possibility of Omicron having a higher virulence and an associated increase in the rate of severe infections. And this means that we may need to prepare to surge our ICU bed capacity even up to 500 beds. We do have sufficient stock of ICU equipment, medications, and other treatments to care for this projected number of ICU patients. And we've worked with our public hospitals to study whether infrastructure upgrading needs to be done to better support and provide care in our hospitals. We've reviewed our clinical protocols and processes regularly with our intensive care specialists and infectious diseases experts. These protocols were tested when we experienced our surge of community cases with increased hospital admissions in October and November. So we know that these protocols are robust and enable us to provide good clinical care. Notwithstanding this, we continue to tweak our processes for diagnosing COVID-19 infection in suspected cases, triaging them for care in ICU, general wards, or in the community facilities we have, deciding when and how to use the therapeutic medications available to us to reduce the likelihood of clinical deterioration or death. And this is all in anticipation of a future situation when our admitted numbers of cases may exceed even what we had previously experienced. Some of these reviews will only complete in the new year as we prepare for possible future waves of infection in 2022. We've also examined our healthcare manpower situation and have plans to further augment our healthcare staff who have worked very hard to look after COVID-19 and non-COVID-19 critically ill patients in the ICU. At this time, as our ICU bed occupancy has eased, our hospitals have taken the opportunity to allow their healthcare staff to take leave and rest away from high-intensity clinical ward settings. They've also planned for staff to undergo refresher training so as to keep their competencies warm in readiness for further redeployments of staff back to the ICUs and COVID-19 isolation wards. If we need to ramp up ICU beds for COVID-19 cases in future, we expect more staff who are presently caring for non-COVID-19 cases in both ICU and non-ICU ward settings to be redeployed, and the refresher training will be invaluable to empower them to take on these new roles. Even though the ICU situation is improved, our hospitals continue to rotate such manpower into the ICU to maintain currency. Each time we ramp up our COVID-19 dedicated ICU bed capacity, we do thin out the manpower that was previously assigned to provide lower acuity or less urgent clinical care. This does potentially degrade the clinical service that hospitals may provide, and there is a significant adverse impact on resources dedicated to non-COVID-19 clinical services. I'm therefore mindful that while we have the ability to surge to 350 beds and beyond, we will not be able to do so in a very sustained fashion without ultimately compromising on the clinical services or care of non-urgent cases in the hospitals. And this is why it is extremely important for us to put in place our strategies to reduce the incidence of more severely ill COVID-19 patients when we face new community waves of infection, whether from Delta, Omicron, or other emerging variants. We've also examined our community-based facilities to ensure we have adequate capacity to treat these infections. Our current occupancy of our community treatment and isolation facilities is low due to the downtrending of community cases. We retain sufficient reserve capacity to ramp up when needed to accommodate more COVID-19 cases in the community. As Minister Ong has shared, we are working to tweak our clinical and care protocols to optimize the use of our resources to better match the clinical needs of our patients. We have a close partnership with private hospitals in Singapore. They have stepped forward to contribute some of their bed capacity to care for COVID-19 patients, and I'm grateful for their willingness to support us in this national effort. The private hospitals and some private primary care groups have also partnered our public healthcare institutions to operate some of our community treatment facilities. They will continue to play an important role if and when we ramp up our healthcare capacity for COVID-19. In addition to expanding the scope of vaccinations and boosters vaccinations, MOH has also worked to procure a sufficient supply of COVID-19 therapeutic drugs to reduce the risk of severe infection and to protect our overall healthcare capacity. Similar to vaccines, our strategy is involved procuring a portfolio of different therapeutic agents. This allows us to cater for a wide variety of different clinical indications while ensuring supply sufficiency. I'm unable to provide a lot of detail concerning these therapeutic drugs, which Singapore is committed to procure, as the procurement arrangements are commercially sensitive and confidential. But suffice to say that the portfolio comprises a range, including remdesivir, immunomodulating agents, monoclonal antibodies like Regeneron, and antiviral drugs. Many of the drugs are already available. While we have planned to procure more of these drugs, we have been shown to have benefit in improving outcomes in COVID-19 patients in timely fashion. And our plans are to ensure we will have sufficient numbers of these drugs when we need them for all our patients. We are reviewing whether the clinical effectiveness of our existing portfolio of therapeutic drugs is significantly compromised by the Omicron variant. With the many mutations present in the S protein of the variant, there is a possibility that some monoclonal antibodies may have reduced effectiveness. And this forms a research priority in clinical labs around the world. Our own clinical scientists will be looking at this and will seek to validate some of the early findings so that we have a good sense of what will work and benefit our patients. At this time, all the other therapeutic products appear to have good effect still in the fight against COVID-19. We will adjust our procurement strategies as needed to ensure our portfolio remains clinically effective and will help to reduce the risk of morbidity and mortality in our patients. The ongoing Delta wave and the prospect of seeing Omicron cases in the community oblige us to ensure that the therapeutic armamentarium we have will cater for both viral variants. And we will also explore whether to tailor treatment protocols based on the variant detected in the individual patient. My colleagues at the NCID will be refining their clinical care guidelines to take this into account. Thank you.
Good afternoon. We all know that a new wave of Omicron infections has emerged in countries everywhere. We've picked up some cases in Singapore, but for now, they are relatively contained. But it is a matter of time before we see new clusters of Omicron emerging in our community. It may well happen in the next few weeks or within the coming month. And given the high transmissibility of Omicron and the risk of reinfection, there is a good chance that this Omicron wave will come before us in our midst, and it will potentially be a bigger wave than what we had experienced with the Delta variant. If Omicron results in milder cases, we will be okay. But if Omicron's severity is similar to what we have seen with the Delta variant, then we will be in a much more challenging position. And that's why our entire public health posture is now geared towards preparing for Omicron. It means that our overall safe management measures have to remain where they are now. So our prevailing measures will remain for the time being. And meanwhile, we will continue to push ahead with vaccinations and boosters because, as you heard just now, they are still very effective in preventing severe illness against when someone is infected, even with the Omicron variant. And because of the importance of vaccinations and boosters, we will also strengthen our vaccination-differentiated safe management measures, or our VDS. And from 1st of February onwards, we will expand the VDS to more settings, and that will include all indoor sports facilities, institutes of higher learning, as well as to leisure guest hotels, hostels, and serviced apartments. We will also remove the concession for smaller events to proceed without the VDS. Today, events with attendees fewer than 50 people do not need to implement VDS. We will remove that concession from 1st of February, and which means that all events, regardless of event size, will need to be VDS, and that means only vaccinated persons can attend these events. With vaccination requirements, we can also, as you heard from Minister Gan just now, ease the default work-from-home arrangements. So from 1st January onwards, we will allow up to 50% of those who can work from home return to their offices for work purposes. And we will also allow work-related events to take place. But we are now considering to remove the concession for unvaccinated persons to return to their work site with a negative test. Earlier, when we put in place the workplace vaccination requirements, we had this concession that if you are unvaccinated, you can still go back to the office subject to a negative test. We are considering to remove this concession, but it does have implications for employers and workers, and that's why we are consulting and discussing with our tripartite partners on this particular move. And we will provide more details when the arrangements are finalized. With these series of measures, we are effectively enhancing and strengthening our VDS measures. And that means that across a whole range of different settings, whether it's activities, events, indoor premises, workplaces, there will be more restrictions on unvaccinated persons. Because unvaccinated persons are at risk, should they get infected, there will be severe consequences and we have to protect them. For vaccinated persons, well, these settings, they will be permitted to go to these settings or take part in these different activities and events. But as you heard from Minister Ong just now, the definition of a fully vaccinated person will eventually be updated to include the boosters. I've described some of the additional measures we are putting in place to prepare for the Omicron variant, but at the end of the day, personal responsibility remains crucial. So please stay disciplined, cooperate fully with all the SMMs, and get into the habit of self-testing regularly, especially if you are planning to go for a large-scale event, going out to meet your elderly parents, or even going out to visit a friend in a home where there may potentially be a few people there. I think it is responsible for us to test ourselves beforehand. I know all of us are hoping to see the pandemic come to an end soon, and in the last few weeks with cases coming down, I think there was a sense of hope that things would improve before too long. Unfortunately, the pandemic is not ending soon. In some ways, this is perhaps the calm before the next storm. So we do have to brace ourselves for the Omicron wave. We have dealt with such waves before, and we can do it again. So let's press forward with resolve and solidarity and get through this coming wave together. Thank you.
Thank you.
Thank you, Ministers and DMS. We will now begin with the Q&A segment. Dear members of the media, as we only have a short time for the Q&A, we seek your cooperation to keep to one question only and to keep your question short. Please remember to use the raise hand function on Zoom if you would like to ask a question. If you are called upon, you will be prompted to unmute yourself. Please do so accordingly. May we have the first question from ST?
Hi, thank you, Ministers, DMS. Now I'd like to ask, on one hand, we say that we are bracing ourselves for this second wave, this new Omicron wave, and there's so many uncertainties, so we have to play it safe right now. But on the other hand, we seem to be easing certain measures, such as almost fully reopening the Malaysia-Singapore borders and allowing more to return to work. Why are we doing this when there are still so many uncertainties over Omicron and we don't know all the facts yet? Thank you.
In fact, as you heard just now, we are putting in place additional measures, in particular, strengthening our vaccination-differentiated SMMs and also pressing forward with vaccines and boosters. These are important responses to the Omicron wave. Where it comes to work, for example, we do at some point have to allow people to return to the offices. It's not sustainable to continue with this present arrangement, nor is it sustainable to keep our borders closed throughout. So for these important measures, we have to learn to move forward and in a way adapt to this reality that the virus will be with us for the long term. So where it makes sense, on a risk basis, we are tightening, we are strengthening our defenses, and we are also, as you heard just now, expanding and strengthening our healthcare system to prepare for the Omicron wave. It will happen, but at the same time, we have to learn to live with the virus.
Can I just add 2 points? One is we are not fully opening what we used to have with Malaysia through the land link. Now several bus trips a day, nothing compared to the hundreds and thousands of to and fro that used to happen on this causeway that is actually the most busy crossing in the world at one point. Secondly is the whole point of us trying to adapt to COVID-19 and living with it as an endemic disease means that with each wave, we should find ourselves more resilient. More resilient means don't go back to CB. And if we push ourselves further, don't go back to P2HA. And we have to try our best to be able to open up gradually, and each time we see another wave, new clusters forming, we don't have to throttle all the way back into very painful, safe social restrictions. We can't rule it out, but they must always be our last resort. And that, I think, is a sign of resilience.
Let me just add a very quick point, especially on the travel arrangement between Singapore and Malaysia. As you know, the border has been closed, practically closed for a long time. We are not allowed to travel, and there's a separation among the family members. And today we are announcing an additional provision to allow citizens who are not long-term pass holders of the other country to be able to travel to visit their family members. So this is very important. As Ms. Ong and Minister Wong mentioned, some of these measures were important in the beginning when there's a huge outbreak, and therefore we need to be more cautious, but it's not sustainable in the long term. And the relationship cannot be severed for the long term, and therefore it's important for us to find ways to get back to this connection. But at the same time, we are not opening up for free for all, like Minister Ong mentioned, like what we have before. In fact, even today with the vaccinated travel lane, they are still subject to a very rigorous testing regime, both ART as well as supervised ART, so that we make sure that there is a check and balance in place to allow us to open in a safe way.
Thank you, Ministers. Can we have the next question from Zhao Bao?
Hi, good afternoon, Ministers and DMS. This is Zhifeng from Zhao Bao. Some parents are concerned that once vaccination is rolled out for children aged 5 to 11, their unvaccinated children might be barred from entering school, library, or shopping malls. So may we know if children in this age group would be subjected to VDS as well? Also, will booster shots be considered as a criteria? Yes. Thank you.
Today, we have Dr. Janil and DMS with us because we wanted to give a medical aspect of children vaccination. What you ask are very pertinent questions, considering the policy towards vaccinated children or unvaccinated children. We are working through the details with MOE, and in the coming few days, we will be able to answer holistically all these questions. Today, with your understanding, we just want to stick to the medical aspect, which is why Dr. Janil is here. So, akan datang, wait for a while.
Thank you, Minister. Can we have the next question from CNA? CNA Sherlyn.
Hi, Mrs. and DMS.
Go ahead.
Mrs. and DMS. My question is about the possibility of that and also follow.
Sorry, connection is in and out, so we can't hear your question.
Hi, Sherlyn. We'll skip your question for now as your connection is intermittent. Can we have the next question from Reuters, please?
Good afternoon. So we're just wondering if it would be unfair to the children if, if they are being they will be subjected to VDS, but then if it's their parents that decided not to get them vaccinated? Thank you.
Yeah, thanks for that question. I know everyone is interested to know the policy treatment. We are working through all this with MOE, so don't jump to conclusion too soon. Once we have chart out the whole plan, together with MOE, we will announce the arrangements and the policies. I'm afraid I couldn't answer the last two questions from Zhao Bao and then Reuters. Maybe you should give them another question that we can answer.
Thank you, Ministers. Can we have the next question from Mothership, please?
Hi, good afternoon. Can you guys hear me?
Yes, go ahead.
Okay, so my question is with regard to the land VTL. Will there be any limitations on Singaporeans and Malaysians using the land VTL? And like, for example, do you have any advice for people who want to go to Johor Bahru for like day trips, for example? Thank you.
My advice is that you have to assess the situation and whether or not the risk is worth a while, making the visit, depending on the purpose of the visit. So the primary objective of the land VTL so far is to encourage and to provide the opportunity for families to be reunited, especially for those who have been separated for a long period of time, taking into account that many Singaporeans have relatives in Malaysia and many Malaysians have close relatives in Singapore. So this will allow them to have an opportunity to be reunited after a separation for almost 2 years. So I would encourage you to consider very carefully if you want to spend just a day. Bear in mind that there are testing regimes in place. You will need to be subject to the regular tests. So it is something that you have to take into account.
Thank you, Minister. Can we have the next question from CNA, Shirlene again? Hi, Shirlene. Maybe you want to type your question. We'll move to the next question. Can we have the next question from Channel 8?
Hi, Ministers and DMS, calling from Channel 8 News here. Just wanted to clarify on the VTL land in Malaysia. So when we are saying that we are allowing Singaporean citizens from both sides to enter, does it mean everyone, like it's for leisure travel also can? Just a clarification. Also, the mode of transport, will it still be just the designated buses and also only at Woodlands Causeway, or are we looking at second link opening up as well? We'll appreciate if we can get a Chinese response as well. And earlier on, on the approach to Omicron.
Hi, Pauline, please get to one question.
Thank you.
Okay, let me first answer in English, then I'll try in Mandarin. For the land VTL, it is open to all citizens of both countries, so you can go across, and it will be subject to the usual vaccination VTL requirements. And the current arrangement is also only on Woodlands and as well as on the buses only. We continue to review and see whether we can expand to other modes of transport. One possibility I mentioned earlier was via train, and it's something that we continue to discuss with Malaysia on how we can expand to additional modes of transport. And this will also have to take into account the infection situation in both countries, both sides of the causeway. And when we have additional information, we will give an update to the public as well as to the media. Let me try to say that in the Mandarin. 新马两地的这个疫苗通道呢， 今天我们宣布说，两国的国民可以通过这个疫苗通道能够进行来往，因为过去你必须是对方的长期准证持有者，你才能够到对方的国家。比如说新加坡人要到马来西亚去你必须是马来西亚的公民，或者是马来西亚的长期居留者或者是永久居留者，或者是长期准证的持有者，你才能够到马来西亚去。那么从12月20号开始呢，只要你是新加坡公民，你不需要持有马来西亚的准证，你就可以到马来西亚去了。但是还是要按照这个疫苗通道的所有的条件。那么疫苗通道目前我们还是只限于这个长堤的这个通道，那么也只限于指定的巴士路线。那么新马两国之间还在进行不断的在讨论希望能够开发更多的不同的交通途径，也能够希望能够最有可能的就是那个通过火车因为上次我也向大家报告说，我们两国之间正在探讨下一步能不能够开通这个火车的通道，让新马两国的居民也能够通过火车能够进行来往。那么如果我们有达到任何的协议的话呢，我们就会向大家报告详情。
我想补充一下用华语补充，然后我会用英文讲。就是新马两地，我们都知道，有紧密的关系我们周围也有很多朋友，曾经是马来西亚人，在马来西亚父母可能还在那里，兄弟姐妹朋友都还在那里。所以这一次我们的这个小开放，其实每一个开放，两边的卫生部都很紧密的互相商讨。这是商讨的过后决定，两边的公民可以过去过岸，通过长堤过岸去，就是认识到我们两个国家紧密的亲戚血缘关系。所以虽然是说每个新加坡人都可以过去马来西亚，每个马来西亚人也可以过来新加坡，但是我们这个开放的精神，我希望大家能够记住呼吁大家不需要过去购物打球什么，最重要的是我们要家庭能够团结。很多新加坡人曾经也住在马来西亚，也曾经是马来西亚人，还有家庭在那里，给他们一些优先，让家庭能够团聚，这就是我们这次小开放的精神。
Thank you, Ministers. We will now take the final question from CNA Digital.
Thank you. Border control measures were put in place for travelers from a number of countries in Southern Africa to protect against the Omicron variant. With many countries such as the UK and the US now seeing a rapid spread of the variant, what will the criteria be for introducing similar border control measures for more countries?
We have a framework already established. It's quite well settled. So I don't think we need to go through again the principles underlying our framework. Right? We look at risk, we look at a whole range of indicators in various countries. We place them in different risk categories, and according to the risk, as the country's situation evolves, we will either update the country or downgrade the country in terms of risk categories. For the VTLs, similarly, following from this experience, we have put in place additional testing protocols to keep travel through the VTL safe. And of course, in the worst case situation, if the country were to really evolve to such a point where the risk becomes very, the infection situation in the country becomes very difficult, then of course we will not rule out more further steps, for example, including the possibility of having to suspend a VTL if that were to happen. So all of this is done on a dynamic basis. We monitor the external environment very closely, and on a periodic basis, every 2 weeks, we will provide updates to our border measures according to this risk framework. But as we have repeatedly said before, any border measures will never be able to keep out the virus entirely. So border measures can help manage risk, reduce risk to some extent, and also help buy us time. But eventually, we must expect the Omicron variant to come into our community. We have already picked up cases, and eventually these cases will come into our community, and we must expect clusters and community spread within Singapore. And we will be prepared for that.